Today we're going to talk about complications of the LEEP procedure. The LEEP procedure is an elongation, an extension type procedure where we have a combination of a suspensory ligament cut. Let's say here's your gland, shaft, and pubic area. We basically make an incision in the pubic area to cause a suspensory ligament release. These ligaments actually hold the penis onto the pubic bone. So if you cut a little bit, it'll help extend the penile length. The other part of the LEEP procedure is to actually implant in a tubular device underneath the skin to help keep the penis elongated and so forth. So it helps prevent flaccid retraction, and hopefully if there's some stretch to the penile shaft, it'll lengthen it. Now, what are the potential complications? Anytime you cut the skin, no matter what, it could be any part of the body, there's always that risk of infection, right? There's always a risk of a little bleeding. That's not really a big deal. And there's other structures involved. You may, for example, if you cut in anywhere, here or on the face, if you, let's say, cut a nerve, right, you might have a little numbness there for a while. But usually nerves grow back, right? You will have a scar, right? That's par for the course when you cut skin, but the objective is to make the scar very thin, right? When it comes to the infection aspect, obviously we try to keep it very clean. We use antiseptics. We use HEPA filters in our room, so we try to do the best we can to keep bacteria out of the way, okay? So let's assume you have a procedure and, of course you'll have a little scar in the pubic area if you have the release done, okay? And let's assume everything is clean, heals well, you get a thin little scar there, everything's good. We don't expect really much to occur there and so forth. Now let's talk about the implant itself, okay? That's a little riskier because anytime you put an implantable device in, right, the risk of infection goes up a little bit more, okay? So we have to be really careful. In fact, the technique is we cut along the circumcision line and we'll slide in the device, right? So what we do in preparation with the device is we soak it in antibiotics, right? And when we transport it, it's transported underneath a bed of antibiotics, a liquid, of course, fluid. And then when we take the device and we slide it under, it comes from this antibiotic solution directly into the skin, okay? So the transfer is important because we want it to be without bacteria on the device. We want the air in the area to be clean. We have HEPA filtration. And when we enter underneath, we want to make sure we have a clear run to place this device without touching too many things on the skin on the outside. Even though we'll use betadine, chlorhexidine, and so forth to clean the skin, the objective is to keep infection rates very, very low. Okay? Now, if that were to occur, and let's say there was an infection with any implantable, it could be a knee implant, a chin implant, it doesn't matter what implant, if there's any signs of infection, unfortunately, they would have to come out, all right? So we'd have to pull it out, let it resolve, clean up that infection, and then maybe some time after, put it in again, okay? And this is kind of standard in the implantable situations with orthopedics and cardiac surgeons, etc. There's always these risks, unfortunately. But again, the objective is to keep them very low. Another issue when you have any implantable is sometimes it can cause a little discomfort. The objective is to place it correctly, okay? If it's placed correctly, usually there's not much discomfort at all, okay? But everyone's different, right? So if we put the device in and we actually have it butt up to some ligaments very deep into the penis here. Some patients may have a little more sensitivity than others. Now, usually over time it will resolve, right? So that's what we do. The remedy there is just waiting patiently for that, okay? So again, let's go through major issues. Let's say any kind of major complication we consider infection, okay? Pain is temporary, so that's kind of par for the course. But that's the primary one, right? If we can get rid of bacteria out of our field, right, then that's 99% of the battle right there, okay? So regarding, again, the LEEP procedure, there's two parts. There's an incision for the release, ligament release, okay? Also, there's the implantable portion, right? Now, patients could have either one. Some patients say, well, I don't want a device implanted. I'll just do the release, which you could do. Some patients don't want the release, but they want the implant. I recommend both because it's difficult enough to get length. And if you do both, you have a better chance of getting some erect length. That's the bottom line. Because the track record for releases, even though the risk is low and you have a thin scar and usually there's no infection involved and so forth, still yet the results are fair. Okay, I wish I could say they're great. Okay, but they're basically fair to good. Okay, with the implant, obviously does three things. Number one, it helps keeps the glands out. So, for example, we recommend first doing a shaft filler treatment. Okay, so we want to build up the girth first. Then the LEEP will be after. When we put the device underneath, we have something to attach it to. That's the most important thing. Okay, but before we actually put the device in and we do penile enlargement, we notice that the glands can kind of tuck under and look like you might look uncircumcised, right? That's the first thing. Second thing is you have retraction, the normal retraction of the penis. These are not complications. These are just observations. We see the natural anatomy of the penile shaft and its retraction force. So we have the glands could tuck under a little bit where you look like you're partially covered or uncircumcised. The shaft itself could pull like it normally does and make it look a little distorted too. So the implant, if we were to put the implant in, it'll help keep the glands out, so that situation will be remedied. The retraction force will be countered with the implant, so that'll be remedied, so you'll be hanging longer. And the third aspect is if we're able to stretch out that penile skin, depends on how much stretch you have, we can possibly get some erect length. Okay, so that's how that works. So again, all I'm concerned about with any implantable or any kind of surgery, and every doctor is concerned, it's basically an infection situation. And again, what we do is we use antiseptics on the skin, we use HEPA filtration in our rooms, and we do all we can to eradicate all bacteria in the field to make sure there is no infection. Now, if you have any questions or concerns about this, please call us and we'll review that with you.